Have you ever had something come across your bench and been like, what is that?
Well, we have.
Sup, people? I'm Katie.
And I'm Angelin. We're the Cool Cats.
And we're here to teach you about basic grossing steps.
In this video, we will show you some basic specimen handling protocols and grossing steps.
You can use these steps on most specimen that will come across your bench.
Take a look at these objectives to see what we will cover in this video. There are 5 things you need to check before you start grossing your specimen. Check the requisition, clinical history, container, lid, and cassette. Does the information on the paper match what you have? The patient's name, medical record number, date of birth, and case number are all standard identifiers to make sure you are working on the correct specimen for the correct patient. In the clinical history, look for reasons why we have this specimen. We always check the lid to make sure we didn't leave anything behind.
As you work, keep good notes on what you are doing, what you see, and any measurements that you make. These will be included in your gross description to give the pathologist a visual picture of what you grossed. Be sure to dry out specimen before weighing it. If the specimen is a hollow organ, you do not need to weigh it. When in doubt, weigh it out.
In the case of our specimen, the suture is oriented as follows: 2 long deep, 1 long lateral, 2 short superior. Orientation will usually be done by the surgeon before the specimen comes to you. If the specimen comes to you unoriented, always call and ask if they can orient it. Sometimes you will have to orient the specimen based off of anatomical landmarks. Know your anatomy and do not be afraid to ask for help or look up the anatomy in a textbook.
Most specimens will need to be measured in 3 dimensions. This includes medial to lateral, superior to inferior, and superficial to deep. Most specimen you receive can be envisioned as a cube.
Some of the terms we use in grossing are not terms that we use in everyday life. I have found that if you use a script of how to dictate, you will always remember to include each point. I describe size, color, texture, consistency, etc. We will show you our sample dictation at the end of the video. See what you can say about it as we go. We will define a couple of the words listed here for you. Feel free to look up some more. Fossilated, covered with many protuberances. Glabrous, free from hair, smooth.
Pause the video here and try using your own descriptive words. We would describe this specimen as a red, bosselated, glistening mass with sparse hair-like projections. This specimen looks like an orange. Can you describe it? We can! We describe it as a spherical, firm mass displaying a dimpled orange surface. This is also known as peau d'orange. Last one!
The exterior displays a firm pink-red and mottled surface with numerous dark red hemorrhagic lesions. The interior has a pale white cortex with central multiloculated cystic structure filled with a sanguineous fluid and firm white nodules.
How'd you do?
There are many different ways to ink a specimen, all of which accomplish the same thing in different ways. In this video, we will be using the 3-color method, which is what is commonly used here at LLU Medical Center. There are pros and cons to each method, but all accomplish the same thing. Everything looks the same after you cut it. Inking is mainly done for us to keep our orientation and define margins for the pathologist, who only gets to see a small portion of the whole specimen.
Most specimens you receive will be bread loaf to reveal the interior surface in a way that keeps the orientation of the specimen and allows you to see as much of the inner tissue as possible. Some specimens, such as hollow organs like the small intestine or stomach, will not be serially sectioned. Others will need to be sectioned in a specific direction to show certain relationships. In this specimen, we will be serially sectioning superior to inferior.
If you have a tumor or area of concern in the specimen, measure it in 3 dimensions and then measure how far away it is from any margins or important structures. It's easy to see the first 2 dimensions, but you need to stack the slices back together to measure the 3rd dimension. Remember to measure the largest dimensions of the lesion.
Have you been practicing your sample dictations? We have. Here's an example of our notes so far.
Choose sections to show the relationship of the lesion to margins and structures. In this case, we submitted the entire superior margin because it was grossly involved. Make sure to note what sections you took and where they came from. Tumor staging is usually dependent on depth of invasion, extension through the capsule, or size of the tumor. If you keep track of where sections came from, you can easily go back if the pathologist or surgeon needs to look at more of the specimen. As you can see, we're writing down where our sections came from. Also submit some sections of tumor only for additional testing. Remember to keep track of what section you submit in which cassette.
Keep the specimen organized by labeling it so that you can go back to it and see what you had done before. I placed a clean paper towel over this specimen and neatly folded it up. Then placed it in a container I received it in with plenty of formalin. Make sure you label your paper towel with pencil because Sharpie and pen will be washed away in the formalin. Here's a summary of what you just saw.
Here's your sample dictation, just as we promised. Pause the video to compare your dictation with ours.
Practice makes perfect. Try to use some of these grossing terms in your everyday life. You could be at the grocery store buying some bosselated blackberries or a glabrous apple.
Thanks for watching. Hope you enjoyed.